Hello again everybody. I looked after a patient recently who has Alzheimer's. She needed a hip replacement, so we had to come up with a plan to help her. In this video I'll tell you about how excellent planning and teamwork can help us to get the best results for our patients, even when there are quite difficult challenges. We all know there are more and more people who have cognitive and memory problems. According to the NHS statistics, 1 in 14 people over the age of 65 is affected by dementia. It affects 1 in 6 people over the age of 80. A lot of these people will have osteoarthritis as well. We're living longer and arthritis is more common as we get older. It's terrifying, isn't it? So I thought it'd be helpful to share with you how we go about managing these vulnerable people and of course their families when they need surgery. If you've got a painful arthritic hip, there's no better treatment than having a hip replacement. It gets rid of pain, improves mobility and helps people stay independent for longer. But when there are memory problems, things get a little bit more complicated. Let's look at what we can do to make surgery safer and how families and healthcare professionals can work together to get the best possible outcome. People with dementia or cognitive problems are living longer and many of them still want to remain as active and as independent as possible. Hip arthritis doesn't wait patiently until everything else is sorted out. It can cause severe pain and loss of mobility, and these of course can aggravate the cognitive problems. Strong painkillers, lack of sleep and poor physical condition all have an adverse effect even when you're in good health. So, is hip replacement still an option if you have Alzheimer's? Well, yes it is, but there are extra risks and we must identify and try to minimise them. The commonest problem after surgery is confusion or delirium, especially in the first few days. This can be very alarming for both the patient and their family. Recovering from surgery might take longer and sometimes more support is needed at home, or we might even have to consider residential care in some cases. In other cases, the stress of surgery and having an anaesthetic can make the cognitive problems permanently worse. Most of the time we use spinal anaesthesia, which is a much safer option than a general anaesthetic. I work really closely with my brilliant anaesthetist and it hasn't been a problem for any of our patients. How do we know that someone with cognitive problems is able to decide on the best treatment for themselves? Here in the UK, we're guided by the Mental Capacity Act. We always start by assuming that the patient has capacity to decide. We check that they can do the following: understand what the operation involves, retain the information long enough to make a decision, weigh up the pros and cons, and then communicate their choice. If they can do all of these things, then they can give valid, informed consent. Obviously, this can change, and we must be very vigilant to check that the patient retains the capacity to consent to treatment. They might even decide that they don't want any treatment at all, and we must respect their wishes. If it is agreed that someone does not have capacity, then the decision is made in their best interests. We involve family members or a legally appointed health and welfare power of attorney. In my experience, it's very rare to need this in elective hip surgery. It's much more common in the acute sector, for example, where someone's had a fall and broken their hip. It would be in their best interests to have surgery so that they aren't in pain. At all times, we're guided by our duty to put our patients' best interests at the heart of every decision that is made about their care. Preparation is everything. We do a thorough preoperative assessment and work with the family to make sure there's sufficient support at home for the patient. I liaise with my anaesthetist and the hospital matron so that everyone is aware of what's happening. Keeping the family involved is really important. It's often the case that the partner of someone with Alzheimer's is not in the best of health and perhaps struggling to cope. We'll advise on setting up a package of care and involve the general practitioner and social services if necessary. We often ask for advice from a consultant who specialises in medicine for older people, just to make sure that we're doing everything possible. So how do we reduce the risk of confusion and delirium? Simple things make a difference. We arrange for one-to-one nursing and make sure that the pain is always well controlled. We encourage family visits and to keep a steady routine. Getting the patient home as soon as they are safe is really important, because the sooner they're in a familiar environment, the better the chances of avoiding confusion. For most people with hip arthritis, the aim of surgery isn't to run a marathon. It's just to relieve pain and keep moving safely. With cognitive problems, the recovery might be slower and the patient may need more help walking or even short-term residential care. Often, all that's needed is a carer to come to the house a couple of times a day for a couple of weeks. What about the surgery? Well, it's the same as for any hip replacement. There is an increased risk of dislocation because people with cognitive problems don't always remember to follow the post-operative precautions. I'll often use what's called a dual mobility hip replacement to reduce the risk of dislocation. This gives all of us confidence in encouraging the patient to get moving as soon as possible. How did my recent patient do? Well, she walked confidently into my office a few weeks after surgery and was delighted to be free of pain and walking independently again. It was fantastic to see how well she'd done, and it underlined the importance of having a great team of people working together to make sure everything went smoothly. If you would like to know more about anything to do with hip surgery, please get in touch. The details are in the description below. Thanks for watching, and I'll see you all again next time.